Before studying the subgluteal approach to the sciatic nerve, it is advisable to study the appropriate essential anatomy as outlined in the Primer of Regional Anesthesia Anatomy. The single injection sciatic nerve block can last up to 24 to 36 hours and is indicated for foot and ankle surgery and painful conditions of the lateral aspects of the lower leg and posterior aspects of the upper leg. It is almost always necessary to block the saphenous branch of the femoral nerve or the entire femoral nerve when this block is performed. The single injection subgluteal approach to the sciatic nerve gives about the same block as the popliteal approach, which is the mainstay of foot and ankle surgery, but if a thigh tourniquet is required, the subgluteal approach is preferable. The sciatic nerve is formed from the 5th lumbar root to the 4th or 5th sacral root of the lumbar and sacral plexuses, and the bony involvement of this block will include a small posterior part of the femur, lateral aspect of the tibia and ankle joints, the fibula, and the entire foot with the exception of the medial aspects. The neurotomes covered with complete subgluteal sciatic nerve block include the posterior aspect of the thigh and knee, the lateral aspect of the lower leg and ankle, and the sole of the foot and lateral aspects of the foot. Most local anesthetics have been used for this block. The preference of this author is to use 15 to 40 milliliters of ropivacaine 0.5 to 0.75% or bupivacaine 0.2%. Buprenorphine can be added, but please keep in mind that the sciatic nerve block per se can be a long-acting block. The patient is positioned in Sims position. The semicircle here outlines the greater trochanter of the femur. Mark the midpoint of this and feel for and mark the midpoint of the ischial tuberosity. A line is drawn which joins these 2 points, and the midpoint of this line is measured and marked. Now draw a midline perpendicular to this line. This line indicates the position of the sciatic nerve, and the dotted line indicates the intended path of the catheter should a catheter be indicated. After disinfecting the skin and subcutaneous tissues are infiltrated with local anesthetic agent. The 22-gauge 50 to 100 millimeter stimulating needle enters the skin perpendicular to the skin until the sciatic nerve is stimulated. If the medial aspect of the sciatic nerve is stimulated, the motor response will be plantar flexion of the foot. More lateral on the sciatic nerve, the motor response will be eversion of the foot. Injection of local anesthetic agent or normal saline will cause the muscle twitches to stop immediately.